Well, in an effort to advance treatment and prevention, the American Medical Association says that they are officially recognizing obesity as a disease. It has a lot of people talking. Fox 7's Alex Villarreal brings us this story, which is causing a division in the medical field. Alex?
Loriana, not everyone is comfortable with the disease label, even within the American Medical Association. Here's what two Austin registered dietitians have to say. When you measure weight relative to height, you can determine your BMI, or body mass index. It's a typical tool doctors use to assess your health. This week, the American Medical Association passed a measure saying obesity is a disease.
I actually have many patients that have become obese because of prior accidents, and so it has limited their mobility. I've had also several patients that are required to be on multiple medications that unfortunately do cause weight gains.
Valerie Castro is a bariatric dietitian coordinator at the St. David's Bariatric Center.
So every story is different, but unfortunately everyone just assumes that people are practicing poor lifestyle choices.
Preventive medicine already knows that the majority of chronic disease is related to lifestyle choices, not to our genetics.
Deirdre Earls is a registered dietitian.
The vast majority of people who are clinically obese have not been the victim of an accident. They've not been the victim of circumstances that have made them a true victim.
The disease label could create more support for insurance companies to pay for obesity interventions like lap band and gastric bypass surgery.
It's going to save the healthcare system probably millions of dollars. So many people are ideal candidates, are ready to make these changes, and unfortunately don't have their policies currently don't cover bariatric surgery. So I think this announcement would really benefit our population.
It's only a quick fix. Nobody knows what the long-term consequences of stapling a stomach or taking out a stomach will be. This is a brand new procedure. Whereas it may have some short-term benefits, nobody knows what the health of these people will be like in 20, 30, 40, 50 years from now.
The other hope is for the general public and physician community to focus more closely on the epidemic. Doctors say 1 in 3 Americans are obese.
We just as a whole population, in order to combat this epidemic, need to thoroughly research and educate ourselves.
There is significant evidence that shows the power of a plant-based whole foods diet to not only optimize long-term health, but also to prevent, manage, and reverse a bevy of chronic diseases.
A report from the AMA's Council on Science and Public Health concludes the disease label is likely to improve health outcomes for some, but may worsen outcomes for others who are obese. Tell us what you think about this story in a Fox 7 Your Opinion Counts text poll. Do you think obesity is a disease? If you do, text yes to 81419. If you don't think obesity is a disease, text no to 81419. And remember, message and data rates may apply. We'll bring you the results coming up in 15 minutes. We asked our Fox 7 Facebook fans if they think obesity is a disease or more of a lifestyle. Michelle Pierce writes, it all depends. If it is related to thyroid issues, then yes, but flat out overeating, nope. Josh Esparza adds, nope, laziness is not a disease. Put down the fork, America.